Mr. President, I ask unanimous consent that the reading of the amendment be dispensed with.
Without objection.
Mr. President, I do want to thank the senator from Louisiana who's managing the bill for her side for allowing us to go forward with amendments. That is, I think, very important. And I do have an amendment that I think will help our small businesses and our states throughout the country. The co-sponsors to amendment number 197 are Senators Hatch, Kyle, Barrasso, Burr, Johans, Murkowski, Cochran, Moran, and Ensign. We're approaching the one-year anniversary of health care reform becoming law, and it is important to highlight the reality of what this bill has done to every American family, every patient, every doctor, healthcare provider, and every small business in this country. 1 year later, the skyrocketing cost of healthcare is still the #1 concern among our nation's job creators. Just today, my office heard from a small business in Corpus Christi, Texas. It has 34 employees, and the cheapest option for health insurance this company has now gotten the bids for renewal for the policies that they had before, represents a 44% increase from last year's costs. They have until April 1st to decide whether or not to continue to offer their employees health insurance and to try to figure out how they're going to compensate for that increase in cost. But Mr. President, this isn't the first small business that I have heard who is telling me the same thing, that their premiums are coming up for renewal. They're getting bids, they're trying to get the best bid that they possibly can, and the costs are skyrocketing. These price increases have not happened in a vacuum. They are the result of the 2,000-page, $2.6 trillion health care bill signed into law a year ago. 1 year later, after that bill was signed, small businesses are facing unprecedented premium increases. Their policies are being canceled as insurers close up shop because of new federal regulations. The reality that the small business tax credits touted by the administration are really just an empty promise that a majority of small businesses will never see. In fact, the Obama administration has estimated that by 2013, as many as 80% of the small businesses will not even be offering their current health care plan anymore due to the new federal regulations and mandates and the increasing costs, leaving the promise that our president made, if you like what you have, you can keep it, as a distant memory. A former director of the Congressional Budget Office has warned that health reform includes strong incentives for employers and employees to drop employer-sponsored health insurance for as many as 35 million Americans. A recent employer survey conducted by the National Business Group on Health reports that 81% of employers have experienced increased administrative burdens because of health reform. This same survey also reported that because of the increased costs from health reform, 68% of employers are increasing the contributions required for dependent insurance coverage. The Congressional Budget Office agrees and has reported that these increased burdens and mandates on employers will result in fewer jobs as well as a shift from full-time to part-time jobs in our country. The Congressional Research Service adds that lower wages will also become a reality because of the new employer mandates. The only good news that our small businesses have gotten recently on this health care reform bill is from the courts. 2 federal courts have found the law unconstitutional, one in Virginia and one in Florida. In January, the Florida judge voided the entire law because the Constitution doesn't allow Congress to force individuals, small businesses, or families to purchase anything just because you live in this country. That is why I am offering an amendment to Senate Bill 493, the the Small Business Innovation Bill that would delay any further implementation of health reform until the Supreme Court rules whether or not the law is actually a valid law. Included in the 2,000 pages of the law are provisions that harm small businesses, their employees, and families. The health reform law contains $500 billion in new taxes, cuts nearly $500 billion from Medicare to fund the new government entitlement, and puts the federal government between patients and their doctors. Health reform requires individuals and businesses to buy government-approved health care or have IRS agents knocking at their door. If business owners want to grow their business and hire new employees, health reform says if you have over 50 employees, there will be costly new federal regulations with which you have to comply. Small businesses across the country who are in the 48, 49 level of employees are now facing a federal mandate that discourages them from hiring more people. This in one of the highest unemployment times in our country's history. We need to get government off the backs of small business, our job creators, and stop putting up miles of red tape that restrict innovation. This bill is the perfect place to do it. My amendment would pause further implementation of this law so that we don't spend millions of our taxpayer dollars and our small business dollars implementing a bill that ultimately could be struck down by the highest court in the land in a case that has already said the law is unconstitutional. So it is making its way to the Supreme Court as we speak. In addition to the effects on the individuals and small businesses of our country, state legislators and governors across our country are also making very tough decisions needed to close nearly $125 billion in budget shortfalls. They too are having to meet the federal mandates of health care reform. Their Medicaid systems are being drastically impacted. Some states are saying, because of the Florida judge's ruling, that they're not going to go further in implementing the law. They don't want to spend the millions if the law is going to be declared unconstitutional by the Supreme Court. On the other hand, we're putting them in the position of taking a chance because there are fines if they don't implement the law in a timely way according to the law that was passed. So if they don't implement, while the court has said the law is unconstitutional, they could pay on the other end by having to have fines because they didn't implement. My home state of Texas is going forward with implementation, but they are facing a $27 billion shortfall in their budget. And yet they're spending money that may be money down a rat hole to implement a law that may not be a valid law. Today, we could take one federal mandate off the list. Today, we can make it easier for job creators to create jobs. The least we can do for the businesses and states and families in our country is to delay the burdens, the mandates, the regulations, and taxes until the highest court in the land rules on whether or not it is a valid law. Mr. President, this amendment would not affect any of the law that has already been implemented. We are not doing something that is retroactive at all. But when this bill passes, everything going forward would be halted until the Supreme Court has ruled on whether, in fact, the health care law that was passed last year is a valid law. I ask my colleagues to join me in taking this heavy burden from our employers and our states. Thank you, Mr. President, and I yield the floor.
President.
Senator from Washington.
Thank you, Mr. President. Mr. President, let me thank the senator from Louisiana, Senator Landrieu, for her tremendous work on